What's up, everybody, and welcome back to the podcast. On this episode of the podcast, we're going to look at should you stop taking painkillers for a chronic low back pain. My name is Robbie Cassidy, and as I say, I got this idea from a question that I got into the group, the Back Pain Back to Exercise group that we just kicked off this week, our most recent cohort. And it was, as I said, it was one of the first questions to come in. It's a common question I get, though. It's one that I think a lot of people struggle with, because when you're dealing with a chronic issue for so long, it's sitting in the background all the time, and you don't want it kind of becomes part of your life. And when you're in the case that it is part of your life, it's easier to avoid the pain or to not have any pain, let's say, than it is to deal with the pain on a day-to-day. So I can see how painkillers become a bigger issue and how they can become kind of a routine, if anything else. So in this episode, we'll explore why relying on painkillers, like let's say opioids or over-the-counter, for chronic back pain may do a little more harm than good, and we'll discuss then different strategies you can use to manage pain effectively because of that. Well, first off, the most important thing is, like, do we need to change is what we need to think about. And each case is going to be different, and it's always important to discuss with your doctor what the goal is with the painkillers. If they just become a management strategy, absolutely it's time to get rid of them then, because a management strategy, like long-term complications, as I'm going to talk about in this, are not worth it, as opposed to dealing with the issue short-term and getting it fixed. Okay, so first off, while the medications can provide like an effective, they are effective pain relief for acute pain following surgery or following an injury, they're not recommended for long-term use. And the reason being is that there's a risk of tolerance, there's a risk of dependence, and then obviously then there can be a risk of addiction. And when we look at some countries in the world now that are really dealing with this type of addiction and dealing with this type of problem, you can see that it has it's taken a grip on people. There's no question it's taking a grip on people, and it can really affect a society. And long-term use then of opioids specifically. Now, opioids not used as much with back pain, but things like Solpadeine, Oxynorm, Oxycontin, it can lead to more of a physical dependence, and the body requires higher doses then to actually get that same relief. So alongside it, you're looking at some side effects, your sedation, obviously nausea, constipation, and if you have asthma, it can become an issue as well, or you get respiratory depression. Now, that's not just in asthma, that's in with overuse of painkillers, that obviously becomes an issue, and that's life-threatening. So it can be only when it's really taken in higher doses, or it's combined with other things. So the over-the-counter ones that you'll generally come across are your paracetamol, Nurofen, and ibuprofen. Now, what's the issue with it? Like, what's the long-term complication of dealing with it? Well, as I said, with the long-term complications with your opioids are a little more severe. Now, the over-the-counter ones, it's more of like chronic issues that start to develop, like gastrointestinal issues, kidney issues, stomach ulcers, you've an increased bleeding risk, hypertension, and then if you're taking it with PPIs, you're at a higher risk of osteoporosis as well. And when your movement is reduced overall because of pain, and you are at risk of osteoporosis just generally, and then you're doubling down on that by taking these painkillers or taking these, I guess, mixing polypharmacy side of things, it becomes a bigger issue, because then all you need is a fall to really cause big problems. So that's obviously the longer term version of it, but it's important to get an understanding of what it is, so when we talk about what you can do instead and what the problem is, I guess, and how the solution, you'll have a better idea of why the solution is a better path for you. So, as I said, overuse of over-the-counter painkillers for chronic back pain, there's a lot of complications involved. We need to be a little bit smarter about it, okay? Because when we're dealing with a chronic back pain, a recurring back pain, when do you get flare-ups, one that you have to continue going back to the doctor for the same issue, it even could be a sciatica, let's say, that's going on for 3 to 6 months to a year, 2 years, 5 years, 10 years. If it's the same issue that keeps coming back, what you're looking at here is a neurological issue. You're not looking at a mechanical issue. And now there could be mechanical signs that go alongside that, but we need to deal with the neurological side of things. And to do that, we need to learn and understand it more. Now, when you start to take painkillers and you're it kind of changes your mindset around what the issue is and what needs to be dealt with. And it is a short-term mindset in terms of you're thinking of, okay, I need to get rid of this for today so I can go about my day. And then tomorrow is the same thing. And then the next day is the same thing. And I often get people coming to me that have been saying, okay, I've been taking painkillers for 6 months to 12 months at this stage, and there has been no solution in sight. It's just become a habit more so than anything else. I'm not taking it for any real, like what it feels like pain relief, because it's kind of, you've dulled it out at this stage. And there's another element to it that you have to admit that there is an enjoyment aspect to taking painkillers. I remember when I was playing football and I had a knee issue that was kicking up. This is years ago when I was maybe 19. So I started taking painkillers before the games instead of dealing with the issue itself. Now, obviously the issue didn't go away anytime soon, but the idea of saying, oh, I can rely on these painkillers because they're going to get me through the game and it's not going to be an issue and I can deal with that later on, that became a thing that I just said, okay, right, I'll take it for this one and I'll take it for the next one and I'll take it for the next one. And then I'm looking at like 4, 5, 6 games in a row taking painkillers for them to try to get through the game. Like that's a talk about short-term mindset, but it happens to all of us. Like we can all kind of, it creeps in. There's an element there that, okay, this is actually isn't that bad. And if anything, there's a bit of benefit to it. There's a lot of benefit to it. So there's no reason for me to stop taking them right now. And I will stop taking them in future. But then that future keeps getting put off and you keep pushing the goalposts out to where the next best time to stop taking them is. Okay. So then we get this rebound pain. Now this is the thing, was when you come off painkillers the first time, you're going to have this rebound pain. And that's where you get the withdrawal symptoms. You get increased pain because the nervous system sensitivity has started to increase. And even more so if you haven't dealt with the issue that's driving the pain in the first place. Okay, so if there's certain factors that are contributing to your pain, let's say, just for example, really high stress or very bad sleep, like poor quality sleep or poor quantity sleep, and you come off painkillers, that pain is going to be amplified, especially at the start as you come off them, because you haven't changed anything. You've just changed the thing that dulls the pain. You've changed the kind of short-term strategy. So we need to make sure that we start to lean into these longer-term strategies about how to work on it and how to improve it. And I better just to let you know as like expectations, because it's important to set your expectations right. Oftentimes when you come off the painkillers with the withdrawal symptoms, you can have headaches, you can have increased pain, you can have nausea. So there is other factors to it depending on the length of time that you've been taking them. Okay, but what we need to think about is, would you prefer to deal with this short-term pain and get a long-term gain where you don't have to deal with it anymore and you're avoiding all the complications and you can fix the issue for good? Or would you prefer to continue living by the short-term gain of dulling the pain for one more day and living with long-term pain where you're have to do it every day for the rest of your life, and it starts to compound and starts to become a bigger issue as you get down the road? So we need to make that decision. It's something that we have to decide, is this something that I want to change? Is this something that I need to change? And if so, then how do I do it? And I start taking the steps in the right direction. Now, it's hard to determine then what normal levels of pain are when you come off. But it is possible to fix it. We just need that plan where we are working on the nervous system as opposed to focusing on the mechanical side of things and hoping the mechanical will fix. Where you see maybe in an MRI, it's, I have degenerative disc disease, I have bulging discs, I have facet joints arthritis, I have whatever, sciatica, all of these other, or scoliosis, these other diagnoses for chronic pain that are not actually diagnoses. They're just signs on a scan that the majority of people have anyway, especially as we get older. And I've done lots of podcasts on that, so make sure to check those out. Why you should stop getting an MRI is one of them, especially for chronic back pain. So I guess what happens is when we start taking the painkillers and when we become so reliant on them, our mindset changes to that we shouldn't feel pain at all at any stage, and we have the mindset of trying to avoid all of the pain all of the time, so we don't deal with what we need to deal with. As I said, it's like coming off painkillers and still sleeping 3 hours a night, 4 hours a night. Your pain is going to be the same, or it's probably going to be a bit higher. So we need to fix that to fix the pain. So there is a lot more to it. It's not just get off the painkillers and go about your day. So what is the solution and how can you work it? Well, what I recommend to people is that you look to taper off it's that you can just drop them and go cold turkey. And once your expectation is right, that you know, okay, for a day or two here, I'm going to feel this a bit more. That's okay. Or you can taper off over a week where you're just lowering it, reducing your intake, cutting it down, seeing how you're feeling, and taking care of all the other factors while you're doing that at the same time. But that is the most important thing. You have to take care of the other factors, or you're just going to jump back on them again. Okay, that's why it's so key. Now, 1 week taper should be pretty good. Understand the pain is going to kick up a little bit more. Understand that we will have to manage this at the same time. So when you're cutting them out, be proactive in what you're doing after it. And when you're proactive about what you're doing, you'll see that it will fix way faster. You'll see that it'll improve way faster, and you'll correlate certain things with the pain that you're feeling. So easy ways to manage a back issue. These are simple techniques that you can manage it short term, and if you use them long term, you can really improve it. And this is what we're doing in the Back Pain Back to Exercise group right now, and it's what we'll be doing then as we go along, as we improve. We create strategic flare-ups, we improve those, we fix them, we get back to exercise, and we start to really build an active lifestyle. But these are some of the simple strategies that we use. First off, you need to focus on taking things down that are causing it to be so high. If we're dealing with a stress-related pain, yes, you can have a degenerative disc disease on MRI, but your pain be entirely driven by stress. So, but if you connect it at MRI, you're gonna have a different perspective on it. We can lean into it a little bit more for dealing with a stress-related pain, because the system has become so jacked up, and it's not that we're doing any damage or any injury to the area. It's more that, because as I was saying, the chronic issues are neurological issues. So when you lean into them, you're generally not doing more damage, because the injury isn't there in the first place. It's just that we're getting pain because of the system is so alert and so protective. So as we lean into it, we will get a better understanding and reinforce to the body that it's actually okay to lean into it. And we notice then that it might actually start to increase first before it decreases. This is when you're dealing with that stress-related issue. So sensitivity is going to be a massive issue overall, and it can stay pretty high once you come off it. Like, your sensitivity can stay up at, like, you can get 7, 8 out of 10 levels of pain if you don't deal with the sensitivity, and if you don't deal with why your body is so protective. Okay, so how do you address this? This is a core component of the Back Pain Back to Exercise group, is that we need to learn about it. We need to understand it before we can fix it. We need to understand why it's happening to you specifically, before we can improve it. Okay, and that's just the way it is. It's the exact same as fat loss. If you don't understand that weight loss or fat loss is calories in versus calories out, if you don't understand that concept, you're going to continue to follow those different fad diets of smoothie diets and whatever other diets they give you out there. But in the most basic level, it's calories in, calories out. As basic as it can get. Now, there's lots of other factors that can affect that. The same with sensitivity. But when we understand that sensitivity is up at an 8 or 9 out of 10, and we need to take it down to a 2 or 3 out of 10, and how we do that, then there's so many different ways, so many different strategies to do it. But we need to understand it to help ourselves. And that's why I push at the start of the Back Pain Back to Exercise group. I have different podcasts I want them to listen to. If you want to, it's Understanding Chronic Back Pain is a really good one. The Do's and Don'ts of Back Pain is another really good one. And then we have the course itself, and the course is a lot more, it dives deeper into like pain sensitivity and the different strategies about how to fix it. Understanding pain, understanding the mindset around pain. That's all within the course as well. And we talk about that more. But we need to do this to help ourselves. Then we can decide what's the best option. Okay, so we know what's causing it. We know how to fix it. And we have all these different strategies then. Do we have to exercise a little bit more? Do we have to do a specific form of exercise or strengthening? Do we have to just get our activity up throughout the day, where we're not just sitting on the couch, where we're getting up and we're walking and we're doing different movements? Do we have to improve our sleep? We have to take our sleep back and actually be strict about getting our sleep back to 10 o'clock and getting up at 7 or 8 in the morning. Is there anything that we can do to improve our sleep at night? Our stress, do we have an emotional outlet? Are we able to offload the stress in some way? Is a stressful event causing us more pain? Because literally, a really simple one, if you understand that a stressful event is causing you more pain, that takes down your pain automatically, because then it's more reinforcing to the body that the pain itself is more because of, like, we're hyper alert of an issue, and we can deal with it differently. But you have to be then, once you understand it and you know what's contributing, you have to be proactive. You have to fix it. You have to understand, I'm going to take the sensitivity down today, and that doesn't mean it's gone for good, but then I can start to work on it, and I can improve its tolerance, and I can improve the body's reaction to it. I can reduce the protective strategy, and I can build back to the lifestyle that I want. And that's how you do it. And that's what we're doing. That's what we do in the Back Pain Back to Exercise program. Like, that's what we do. It's such an important component. Once you take the sensitivity down, you need to build on it. What too many people do is they'll take the sensitivity down once they get off the painkillers, and then they'll start going, okay, right, it's all right now, I won't do anything about it. You wait 2 months and it's back up, and your back issue is happening again. But this time the issue happens, it scares you more. So you go to doctor, you go to consultant, and you say, what's the best option? It's been happening to me non-stop for years. I don't know what to do. The painkillers aren't working. I've got the dry needling. I've done the acupuncture. I can't do anything else. I can't try anything else. And there you get a recommendation for surgery, where you have to go in and get a fusion, or you have to get some form of surgery on your spine that you didn't need in the first place, because it's not the driver of your pain. It's like saying, I have back pain, and going in and getting an ankle surgery. Some of them, because they're unrelated to what you're fixing and what the pain, what's causing the pain. So, and you see it then, that people go in, they get surgery, and then 6 months later the same thing kicks up again, because they didn't address the issue of what the issue was. The one thing about surgery is when you come out of it, you have to do the rehab. That's the thing. That's like when they look at rotator cuff surgeries. If you look at 6 months, 12 months down the line, it's nearly the same outcome. It is the same outcome. But when you do the surgery, you have to do the rehab after it. And this is when they've done rotator cuff surgeries. They've had a control where they didn't do any surgery, and they've done a sham surgery. I've done podcasts on that one as well, where I look at sham surgeries and how the perception of even the possibility of having a surgery done changes your reaction, which changes your pain, which changes the outcome. So there is more to it, and you have to be proactive. This isn't to tell anyone that you need to drop your painkillers right now and just get off them and go about your life. This is more about understand these. This will happen when you do drop them off. It is important, if you're dealing with a chronic issue, to lay off the painkillers, because the mindset around taking painkillers doesn't lend itself to a long-term solution with the pain, because you do need to lean into the pain. You do need to understand the pain first before you can fix it. So it is important, and we can do it. Like, it just takes time. That's all it is. It is the first step, though. I have to say, it's the first step to changing your life if you're dealing with a chronic injury, is leaning off the painkillers and tapering off when possible. It is really the first step to doing it. And if you can do this, you are moving yourself in the right direction. And that's what it's about. It's not about getting everything right first time. It's about taking 1%, 5%, 10% gains, pointing the compass in the right direction and working towards what we want to get back to. Whether that be a healthy, active lifestyle, whether that be getting out so we can climb Kilimanjaro, or getting out so we can go for hikes, or we can go for walks, or we could go for runs, or we can do challenges with our family and friends, or play with our kids. This is what it's all about. But you need to take the first step. Hopefully, that helps people to understand, do you take painkillers? Do you not take painkillers? What's the best option? If you're dealing with a chronic issue, probably not the best option. If you have any questions, shoot them over to me on Instagram at @RobbieCassidy_. And I will do my best to answer them. Other podcasts that you could follow up to this one are, as I say, the do's and don'ts of back pain, understanding your chronic back pain, fixing your chronic back pain. I have so many of them. How moving can help your chronic back pain, because it's something that I dive into deeply. And there's more to back pain, as I said, than the mechanical. It's the neurological, it's the conscious, it's the subconscious, it's our reactions, it's our behaviors, it's our habits. All of these things contribute to why the issue sticks around longer than it has. So check out those podcasts to understand that better. If you want to hit the link in the description of this podcast to check when the next program is going to be kicking off, our next Back Pain Back to Exercise program, probably not for another couple of weeks, but if you want to, you can go in, you can download it now, and you'll get access to all the materials that I've talked about, and then you'll be automatically put into the next group when it does kick off. But you'll have access to all the materials that you need, and then when the group kicks off, we'll have your Q&As, we'll have the live trainings, we'll have that group and community aspect, and we can dive into it a lot more. But that's all for me today. I hope everyone out there is doing well. I would love if you could please rate this podcast. It goes a long way in promoting it. I really, really appreciate it. And yeah, just if you're on Spotify, scroll up to the top of Spotify, and please, I'd love if you could give a 5-star rating if you found it beneficial. And on iTunes, it's the same thing. It goes a long way. Thank you to everybody, and I will chat to you all again very soon. Have a good one.